Good morning, everyone. Before we proceed, I just want to thank all the delegates that are here right now because impact would have been impossible without your presence. We all know that the most valuable commodity in life is time, and we are honored that you have chosen to share it with us today.
A lot of you must be thinking, why should there be a conference solely focused on mental health? We have all seen so many posts in social media regarding mental health on 10th October, the World Mental Health Day, which was a whole month ago. So, why is there a need to discuss it again now?
Mental health, unfortunately, has a lot of stigma surrounding it. In fact, according to a survey conducted by the UNICEF in early 2021, only 41% of young people between 15 to 24 years of age in India said that it is good to get support for mental health problems. This just goes to show that the statistics we know of those suffering from mental health are just the tip of an iceberg, as there may be so many more who are reluctant to seek out the help because of the stigma. Mental health, when not taken care of, can hamper your day to day life and not only significantly impair your productivity, but also cause detrimental effects on other aspects of your life. According to WHO, mental health is the very foundation of your well being and effective functioning of individuals. This is one of the pressing reasons why it is never too late to start talking about mental health and always keep the ball rolling on this topic.
Today, we are facing a psychological epidemic exacerbated by the COVID pandemic. According to the Indian Journal of Psychiatry in 2019, even before the pandemic, at least 50 million children in India were affected with mental health issue, out of which 80 to 90% have not sought support. As the pandemic heads into its third year, its impact on mental health continues to weigh heavily. Limited access to support from social services due to lockdown, the disruption to routines, education, recreation, as well as concern for family income and health has negatively impacted many individuals.
Especially with a culture today driven by social media that focuses on positive expectations, which portray a mirage of a perfect life, happiness, and satisfaction, incites us to share the good parts of a life and hide out the rest. The theme of this year's World Mental Health Day is Mental Health is an Unequal World. While people from all ages, backgrounds, ethnicities, etc., have struggled with mental health issues, research has shown that it's been unequally distributed. Vulnerable communities, along with their own pre existing challenges, find it excruciatingly hard to seek out help, which once again shows why it's important to talk about things and to raise awareness to not only help yourself but also to support those around you.
This is the goal of Impact, a journey within, to stimulate a sustainable and positive discussion on mental health that transcends all boundaries. With Impact, we aim to break the silence surrounding mental illness by addressing stigma and promoting better understanding of mental health. To speak a little about us, Switch India is a healthcare organization run by more than 2,500 medical and paramedical students and personnel from across the country with the shared goal of making healthcare more accessible to all sections of the population.
It was started with a health camp in a small village, screening around 70 patients in 2016. And today we have branched into initiatives for physical fitness and mental health, conducted dozens of health camps and awareness campaigns in urban and rural areas, and in collaboration with various organizations to conduct medical workshops, seminars, and educational field visits. Throughout the pandemic, we have been collaborating with other NGOs to help those in need.
Inside Out is one such initiative, started by Switch India to simply put, reach out and help those struggling with mental health. We provide non judgmental, friendly ears to give you a space to vent out and decompress, as well as have a team of professionals you can out to. We run a free, personalized, and confidential email support group to which our volunteers respond to within 48 hours. We have managed to counsel more than 120 clients across 7 countries till now. Our other current ongoing initiatives include Dear Diary, which was born out of the need to recognize and appreciate individual victories. Follow us on Instagram to get some amazing techniques to ensure psychological well being, interesting cases, and useful infographics.
This conference, Impact, is launched with the hopes of continuing our primary focus, that is, to integrate mental well being into day to day discussions and challenge the stigma around it. We intend to do so with carefully curated events for the conference. With our pre conference competitions conducted in the theme of mental health is an unequal world, we were able to generate buzz in social media platforms around this topic and received several creative entries. The winners of each, along with their work, will be shown today.
We have two workshops facilitated by Ms. Srishti Sen Gupta designed to help you develop the skill set of regulating your own as well as your colleagues' mental health, thus enabling you to create a holistic working environment. We have reputed speakers like Dr. Shubhangi Parkar, who was previously the HOD of Psychiatry, Seth GS Medical College, and KEM Hospital, with an experience of working in the field of mental health for over 30 years, giving a talk on intersectionality and social inclusion. And Dr. Payal Sharma Kamath, the founder of Free Kindle Mind Clinic, talking about the much needed toxic effects of social media. We also have Dr. Sameer Parekh, the director of the Fortis National Mental Health Program, giving a webinar on the importance of focusing on mental health, as well as Dr. Purnima Nagaraj, a consultant psychiatrist from Dhriti Wellness, talking about how to deal with grief and loss.
Additionally, we have a panel discussion on the topic of stigma surrounding seeking therapy, the challenges of online therapy by Dr. Avinash, Dr. Vidya, the founder of Good Vibes, and Dr. Janki, founder of Mind Harbor. There is a lot to learn in these upcoming 2 days and a lot of fun to have as well. The conference will provide all of us opportunity to come together and act and ensure that people are able to enjoy good mental health.
All in all, we hope you have as much as fun in the conference as much as we had creating this event. So, once again, thank you for being a part of this conference.